This is a 66-year-old female who had a sudden decrease of vision in the right eye since 10 days, already operated for cataract surgery many years back. Her uncorrected visual acuity is counting finger 2 meters, and on the slit lamp examination we can see that the IOL has subluxated inferiorly, and in the central pupillary zone there is aphakia. We can see a superior iridotomy and the haptic of the IOL coming into the anterior chamber through this iridotomy. The IOP was normal and the visual acuity was improving to 6/18 with a +10 diopter sphere lens. What is the surgical plan for this patient? So here we decide to do a very minimally invasive surgery to reposition this IOL. We will be doing a lasso technique. So as you can see, I'm just going to be making 2 side ports in this surgery. This is the first one, which is opposite to the area of subluxation, and this second side port here is going to facilitate easy maneuvering. I slightly fill the chamber with viscoelastic, not overfilling it. And now I mark 1.5 millimeters and 3 millimeters behind the blue limbus. I take a 30 gauge needle and I pass a 6-0 proline suture, and from the lower marking I am going to enter with this suture, and I'm going to try to create a lasso. So the first part of the suture is going to go between the haptic and the optic, and using a micro forceps I'm going to pull this suture through the other end. Now once this is done, I am going to loop this suture back into the anterior chamber. And now using another 30 gauge needle through the upper marking, which is 1.5 millimeters behind the limbus, I am going to pass this needle above the haptic. And now using a micro forceps, I am going to railroad the 6-0 suture through this needle and gently thread it out of the eye. Now this is going to create our lasso. Now this lasso is going to support the IOL, and very gently now we are going to pull the IOL back into position. Note we have not made a conjunctival peritomy here. So we are going to flange the ends of this 6-0 proline suture. Now the first end I am going to trim it, and with a heat cautery I am gently going to enlarge the end to make a flange, which will be bulbous. And now this flange is going to be buried beneath the conjunctiva into the scleral wall. Similarly, we will do the same thing with the other end of the suture. And this is a heat cautery that I am using. And once this is done, we can see that with this technique elegantly we have managed to center the IOL very well. The surgery ends with hydration of the side port wound. Now this is post-operative day 1. We can see that we've got such a nice well-centered IOL. The central part of the pupil is clear, although there's a small sommering ring, but that is not affecting vision because the uncorrected vision is 6/12 here. And we can see that the 2 ends of the suture are very well buried beneath the conjunctiva. Thank you everyone for watching.